The prevalence of cancer cases in parts of Katsina state has compelled the Katsina Elders Forum to once again urge the federal government, the Federal Ministry of Health, to release the funds appropriated for the completion and furnishing of a cancer center at Katsina Teaching Hospital. The call was made by the Secretary of the Forum at the commissioning of some amenity wards at the Federal Teaching Hospital, Katsina, courtesy of some philanthropists. TVC News correspondent Abdulatif Yusuf has the story.
The increasing population in parts of the country has continued to expose the infrastructural gap that exists and the need for collaborative efforts between the government and the people to address them. Some organizations and individual philanthropists are already taking the lead in provision of complementary amenities in schools and hospitals. These 10-bedded amenity ward were built by some indigents of the state and upgraded by the hospital to meet the required standards.
So this amenity ward, the first one was built by the late Emir of Katsina, late Sarki Kabir Osman of blessed memory. They have tried to build what the well-to-do see when they go outside the country, so as to stop medical tourism. Now that we have this, we have the facilities, we have the personnel, then maybe they will now reduce the way they're looking for dollars and come and patronize our own healthcare professionals here.
The State Chief Judge, Musa Dalladi, led the commissioning of the wards and called on well-to-do to emulate the gesture.
Facilities, I believe our public institutions like hospitals, schools can reach world standard if there is the commitment and the determination. And this is what we are just seeing.
But there is need to put in more effort to properly equipping tertiary health centers to discourage medical tourism. The State Commissioner of Health and the representative of the Elders Forum are on the same page, calling on the Minister of Health to assist the people of the state through the release of the funds meant for the equipment to be used for the cancer center in the hospital.
Last year, when the money was about to be mopped up, we wrote a letter to Mr. President who gave clear directives that the money should be warehoused and be given time to enable all the hospitals purchase their equipment. Now, to date, this minister has not presented the memo, despite the letters received from the president through the chief of staff to Mr. President.
It is hoped that the new hospital wards will not only benefit patients, but will also boost the revenue source of the hospital. Abdulatif Yusuf, TVC News, Katsina.